Dr. Thuy is assistant research scientist in health policy and management at the University of Michigan School of Public Health. She uses modeling and machine learning methods for cancer and tobacco research with applications, of course, for tobacco regulatory science. Dr. Lee has developed mathematical models for childhood leukemia and also models to evaluate the benefits and harms of breast cancer mammography. More recently, of course, she's been using models to look at to quantify the burden of menthol cigarettes in the population. And she's using and applying machine learning techniques to predict and understand smoking behaviors. She received her PhD in mathematics from the University of Padua in Italy. So Dr. Lee, please go ahead and take us away.
Yeah. Hi, everyone. Thank you for the introduction, Jamie. So let me share my screen. Okay, so my talk today is about estimating the public health consequences of menthol cigarettes on smoking prevalence, premature mortality from 1980 through 2018. So all the materials presented here in this talk were taken from these two publications in collaboration with Dr. David Mendes. So here I have no conflict of interest to declare, and this study is spotted by this grant number through TCOS. Okay, so as we all know that we have a very long history regarding to menthol ban in the US. In particular, in 2009, Tobacco Control Act required the Food and Drug Administration's Tobacco Products Scientific Advisory Committee to submit a report and recommendations that address the issue of the impact of the use of menthol in cigarettes on the public health, including such use among children, African Americans, Hispanics, and other racial and ethnic minorities. Then in 2011, the TIPSAC menthol report was submitted with the following conclusions. Menthol cigarettes have an adverse impact on public health in the US. There are no public health benefits of menthol compared to non-menthol cigarettes. Therefore, the TIPSAC menthol report made the following overall recommendation. Removal of menthol cigarettes from the marketplace would benefit public health in the US. In 2013 and again in 2018, the FDA sought public comment, research results, and other information on the impact of menthol cigarettes on smoking initiation, prevalence, and other factors to inform regulatory actions that this organization might take on menthol cigarettes. So more recently, in 2021, the FDA announced plans to ban menthol cigarettes in response to a lawsuit filed by different organizations. And last year, the FDA proposed rules prohibiting menthol cigarettes and flavored cigars to prevent youth initiation and significantly reduce tobacco-related disease and death. So the objective of our study is to quantify the harm due to menthol cigarettes. To do that, we estimated the excess smoking prevalence, smoking initiation, and mortality caused by menthol cigarettes for the general US population and also for the African American population from 1980 to 2018. So here we used a well-established simulation model of smoking prevalence and health effects. This model was developed originally by David Mendes and Ken Warner. So we modified that model to track menthol smokers. So here, the modified model was used to compare health effects of cigarette smoking on the U.S. Population over the study period under two different scenarios. So the first one is the status quo scenario. This scenario simulated was actually happening from 1980 through 2018. And then we conducted another scenario in which menthol cigarettes were assumed non-existent over the same period. And this scenario is referred to as a counterfactual scenario. And the same analysis was repeated for the African American population. Okay, so here is the skeleton of our model. So this model consists of several compartments, tracking the number of never smokers, menthol current smokers, and non-menthol current smokers, former smoker, and also smoking-related premature deaths. So as you can see here, we have many circles. They represent the model parameters. Orange, red circles are for menthol-related parameters, and green for some general parameters. So at the age of 18, an individual is given an opportunity to remain as never smoker or become current menthol smokers or non-menthol current smokers. So all the input parameters were taken from different sources, from census data and also from previous studies. So to project the harm of menthol cigarettes over 1980 through 2018, we first populated the model with the baseline data, the data in 1980. And then we conducted a simulation scenario over the study period. We updated all parameters frequently. And this scenario is the status quo scenario. And then we constructed an alternative scenario over the same period in which we removed the effect of menthol cigarettes. And then we compared both scenarios to quantify the public health harm attributable to menthol cigarettes. So what we are interested in is the number of menthol smoking related premature deaths, life years lost, and also the number of new smokers due to menthol cigarettes. So here in the model, in the status quo scenario, the initiation rate was chosen as the average smoking prevalence among 18 to 24 year olds from NHIS data. But in the counterfactual scenario, we need to compute this the initiation rate using this formula. And we know that menthol experimenters are more likely to become regular smokers compared to non-menthol experimenters. Therefore, when we remove the effect of menthol cigarettes, we obtain a lower initiation rate, which is the initiation rate in the counterfactual scenario. Okay, so there are some key menthol-related parameters in the model that I'd like to highlight here. So the first one is the ratio of years from experimenter to smoker. So this parameter describes the likelihood of becoming regular smoker among menthol experimenters compared to non-menthol smokers. So as we can see here, we have the same value for both populations. And another key menthol-related parameter is the menthol cessation multiplier. So previous studies have also shown that menthol cigarette use is associated with lower quit rate. So this finding is incorporated into the model through this parameter. And as we can see here, in each population, menthol smokers are less likely to quit smoking successfully compared to menthol smoker. So as we can see here. And this difference in cessation rates among menthol and non-menthol smokers is more significant in the African American population. So this would intensify the smoking harm in this population. So what we obtained from our model is following. So here, so if we look at this figure, so the solid circles here represent the simulated smoking prevalence in the counterfactual scenario, and the solid triangles are for the simulated smoking prevalence in status quo scenario. And open circles here are for an HIS observed smoking prevalence. And we can see in both population, the model tracks the NHIS observed smoking prevalence is very well. So now let's take a look at some numbers. So for the general population, we have around 10 million excess smoking initiators due to menthol, and around 400,000 excess premature deaths, and about 3 million excess life years lost due to menthol cigarettes. And for the African American, so here we see that we have 1.5 million excess smoking initiators, around 150,000 excess premature deaths, and 1.5 million excess life years lost due to caused by menthol in this population. But if we assume that the African American population has the same menthol profile as in the general population, then we have only, this number 1.2 excess smoking initiators, or 60,000 excess premature deaths, and 600,000 excess life years lost. So let's take a closer look. So here, the number of excess smoking initiators in the African American population makes up 15% of that of the general population. But if this population has the same menthol profile as the general population, this number is only 13%. So here, if we take a look at the number of excess premature deaths, while the African American population constitutes only 12% of the total population, the number of premature deaths caused by menthol in this population represents 41% of that in the general population. And we obtain similar figures in terms of cumulative excess life years lost here. So in proportion, we obtain more African American life years lost than excess deaths. This is because, cigarettes kills African American at a younger age. So these are very, very heart-breaking numbers. So in summary, over the study period, menthol cigarettes were responsible for millions of excess smoking initiators and hundreds of thousands of smoking-related deaths. So menthol in cigarettes intensifies cigarettes harm by increasing, the chances that individuals transition from experimentation to regular smoking, and also delay smoking cessation. These effects increase the number of smokers and also the amount of time they smoke. And for the African American population, menthol smoking harms this population disproportionately. The African American population is about 12% of the US population, while the number of premature deaths due to menthol in this population is 41% of that of the general population. And if we assume that African Americans had the same menthol profile as the general population, they would carry only 16% of the menthol burden. So as usual, our study has some limitations. The first one is that the results of our work rely on some key parameters taken from the literature. Therefore, the uncertainty of our results is, of course, associated with that of those parameters. And a second one is that, so this is a population model, so we did not take into account individual heterogeneity. So with that, okay. So I concluded my talk here, and thank you so much for all your attention.